Obstructive sleep apnea is a common condition but is often missed. The diagnosis of obstructive sleep apnea is initially made on a screening questionnaire called the Epworth Sleepiness Score. If most of the answers to this questionnaire is positive, then that calls for a more formal diagnostic test called the sleep study, also known as polysomnography. In the polysomnography, the apneic episodes, that is, cessation of breathing lasting for more than 15 seconds, is calculated, as well as the hypoapneic episodes, that is, cessation of breathing lasting for less than 15 seconds. The number of apneic episodes is divided by the number of hypoapneic episodes, and OSA is further classified into mild, moderate, and severe obstructive sleep apnea. There are no blood tests. However, tests to rule out diabetes and thyroid disorders are a must, because diabetes and hypothyroidism can mimic obstructive sleep apnea. It can also complicate obstructive sleep apnea. Treatment of obstructive sleep apnea is multimodal. If at all there is any anatomical abnormality, then the surgery is the treatment of choice. However, if there is no anatomical abnormality, the treatment of choice is BiPAP, that is, bilevel positive airway pressure. Through a small machine, sustained low pressure is delivered into the airways. This low pressure keeps the airways open and also delivers oxygen to the distal or the lower parts of the lung where gas exchange takes place. Because of this, the oxygen saturation remains throughout the night, it remains better, and the person can breathe easily. There is no drugs for the treatment of obstructive sleep apnea. However, in those people in whom daytime wakefulness is a problem, a drug called modafinil can be used. OSA is not an uncommon problem, but because of the non-specific symptoms, it needs to be identified early and treated early to prevent further complications.